All right, so this topic is very important. So we're talking about suicide, which is kind of like a taboo topic, but I think it's really important as psychiatrists. When you're assessing like the safety of your patient, like how bad is their mental illness? Often it's associated with depression, but there's multiple disorders that I'm going to talk about. So we're going to basically break it down into first. During an interview, I always assess if there's immediate risk of suicide attempt, right? So basically, then I determine if there's current or past suicidality. Um, so like what I do is I look at major risk factors, and this is actually based on literature. There's actually a great scale from the Columbia Suicide Rating Scale. But let's talk about this suicide. So there's a great acronym called SAD persons. SAD persons, risk factors for suicide. So chronic suicide risk factors. So sex. Women are more likely to attempt suicide while men are more likely to succeed. Age. Age falls into a bimodal distribution with teenagers and elderly at the highest risk. Depression. 15% of depressive patients die by suicide. Previous attempt, P in persons. 10% of those who previously attempted suicide die by suicide. E. Ethanol abuse. 15% of alcoholics commit suicide. Rational thinking loss. Psychosis is a risk factor, and 10% of patients with chronic schizophrenia die by suicide. Social support, S, are lacking. An organized plan. A well-formulated suicide plan is a real flag. No spouse. Being divorced, separated, or widowed is a risk factor, and having responsibility for children is an important statistical protective factor for suicide. So think about it. You have young kids. It would be really hard for you to kill yourself. Not that it doesn't happen. And then sickness. So you have a chronic medical illness. That's a risk factor as well. Now, for acute suicidality, like if they're going to hurt themselves, like immediately, rage, recklessness, feeling trapped, increased substance use, social withdrawal, anxiety and agitation, insomnia, mood changes, a lack of a purpose or reason for living. So that's for acute changes.